You want to keep the perspective that this is also a medical encounter. Many of you officers have helped patients to get to emergency rooms, to get to hospitals, and it helps to know the diagnosis, have a sense for it, but you do not have to diagnose the patient. It just helps to know the diagnoses. And again, we're going to go over more today. Probably the largest number of people with psychiatric illnesses on the streets are schizophrenic. Schizophrenia is a devastating illness. It has its onset in the late teens, early 20s. If any of you grew up with individuals, people that have schizophrenia, have that illness, schizophrenia is an illness with principally delusions and hallucinations. And the delusions and hallucinations put those people in their own world. They're not in our world, they're in their own world. And as police officers, that's one thing you'll be able to recognize. They just don't seem to be there. They're not there with you. I also emphasize that, and this is a term that's a descriptive, that they are bizarre. They're different. They're very different. They're different from the rest of the population. In terms of being bizarre, they often dress bizarre. For example, you've probably seen people on the street in the summertime wearing large winter jackets. Many schizophrenics, they're somehow trying to protect themselves from the world. They use their clothing very differently. Sometimes you'll even see people dressed in rags. Even though they'll have their usual clothes on, they may have also rags. Sometimes they'll have big hats on. They're outside a lot, so they'll appear weathered. They may be sunburned, they may have very, very dark tans. They often tend to have trouble with hygiene. They may be unclean, may be disheveled. The delusions and hallucinations are what we term the positive symptoms of schizophrenia. They're the very active symptoms, they're the very severe symptoms. Common delusions are delusions of paranoia, and they're going to be, at times they'll be paranoid about police officers, and they'll respond to you that way from their paranoid perspective. They're often hallucinating, especially if they're untreated. Most common are auditory hallucinations. They hear voices all the time. At times, that will be the largest part of their world and their experience. They're hearing the voices. The voices tend to be very negative, derogatory. They'll look like troubled people. Sometimes the schizophrenic individual will also be talking to themselves at the same time. They have what we call negative symptoms. The negative symptoms are not so obvious, but they're very important. Schizophrenic people are not social hardly at all. They've lost the capability to be social like the rest of us. So they'll tend to be by themselves, they'll tend to be withdrawn, they'll tend not to relate and not relate well with police officers, with anyone. So you should expect they're not going to respond like almost everybody else does a police officer. People pay attention to the police. They'll answer their questions, they'll follow your directives, they'll follow your commands. Schizophrenic patients probably will not. They may walk away from you, they may talk to you, they may talk to you in bizarre language. Again, they're very different. Again, you should expect that a schizophrenic person will respond differently. They may walk away from you. They may not answer your question. So you will have to slowly engage them. You'll be able to de-escalate them. They will in time listen. And again, they may have active symptoms because many of them do not take their medication or they fall off their medication. At times like that, they will, again, be hallucinating. They'll be hearing voices. They'll be seeing things. You'll sometimes see people grab at things in the air. That's somebody who's psychotic. Schizophrenia is an illness of psychosis. People with schizophrenia often do not take their medication. There's a number of reasons for this. Part of it can be their delusional system. They may be paranoid. They may feel that the doctor's trying to poison them. Frequently I see that delusion, that their medicine is poison. They've thrown their medicine away. People with schizophrenia, part of the illness is a cognitive disorder. They don't think as well as they used to when they were young. So they cannot literally understand their own illness well. Few people with schizophrenia have insight into their disorder. As part of the disorder, they have poor judgment. They have little insight, poor judgment, often fear medicine, fear the, the doctor, unless they've done very well with their medication, and unless they have the support of family and friends and the mental health system to help keep them on their medication. The medications are antipsychotics. I'm going to name most of them. The older antipsychotics are Haldol. A lot of the patients are on Haldol injections, Haldol decanoate. That's a shot that lasts from 2 to 4 weeks. Another shot that lasts for weeks is Risperdal, Risperdal Consta. Old medications were Thorazine, Prolixin. We have newer medications that have less side effects. Those Risperdal falls in that group. It also can be taken by mouth. Also have Zyprexa, Seroquel, Geodon, Abilify. Those are the main antipsychotics. People will often have the bottle of their medication on them or have an empty bottle or will know the name of their medication. One way to help recognize an individual with schizophrenia is to get to know ask them to tell you their medication that they take.